The following segment is sponsored by Northern Nevada Health System.
We're here at the Northern Nevada Health System with Shelby Hunt, an ER nurse, and you look at so many heart issues that come through the ER. What about heart rate? That's a big issue, right? A rapid heart rate.
It is. Rapid heart rate is significant. A normal heart rate is between 60 to 100.
Okay.
So at a resting, so either sitting in a chair, watching TV, you should be within a 60 to 100 beat per minute rate.
How do we know whether or not our heart is racing in an unhealthy way and to come see you guys?
Sure, there are a lot of different things that can be triggered or that can trigger a rapid heart rate. Yeah. Generally, if you don't feel really well and you take your pulse and you see that it is really, really low, so that less than 60 or greater than 100, that's when you should be concerned. However, there are certain things that actually can put you into a rapid heart rate. So an arrhythmia, which is an electrical interference that causes an irregularity, and that's significant. But even tobacco, smoking, alcohol, caffeine, exercise, prescription medications, recreational drugs, there are a lot of other things like that, dehydration, that can put you into an irregular heart rate.
What does it feel like? I mean, the heart's inside your body and it's beating. Is your face flush? Do you feel overwhelmed? What's the feeling?
Everybody's a little bit different, but usually people can feel kind of a pounding sensation either in their chest, their neck. Some people will get a headache. Some people can get what we call diaphoretic, where you can break into a heavy, heavy sweat. It's just an abnormal feeling that is not normal for yourself. And that's probably the biggest piece, that if you just don't feel really well and you check your pulse rate, that's a good reason to be concerned.
Or you're feeling something like you've never felt.
Exactly. Yeah. Exactly. Not your norm.
Friends with someone who once had a panic attack, and they said, I'm having a panic attack right now. And they said, feel my heart. I put my hand on this person's heart, and it was thumping and really fast. Mm-hmm. And it was a casual walk down the street. We're going to lunch. You never know when it's going to happen, something like that.
So a panic attack can be an internal stimulation that triggers that. And again, as part of that electrical system in your body that's momentary. Most people who know they have panic attacks know to just try to kind of take deep breaths and calm themselves down. But again, it's really a lot of those things that can trigger a rapid heart rate, but it's knowing your own body and what's causing it.
And so when do we know whether or not we need to come to the ER when it comes to rapid heart rate?
Again, it's more if that is not your norm. So let's say you exercise and you can feel your heart thumping. You know, as soon as you stop exercising and you have that rest period, it's going to go back to that normal rate. But let's say you exercise, maybe you're short of breath. You're getting sweaty. That heart rate's not coming down. That's abnormal for you. That's a concern.
I really appreciate your time and talking about an important subject, of course. And for more information, go to our website,